Clinical lab scientists are health professionals who assist in diagnosis and treatment through laboratory technology and methods. The information gained through these processes is then relayed to other health professionals to ensure quick and efficient diagnosis of patient issues and assess the best methods for treatment. We are known as clinical laboratory technicians, medical laboratory technicians, clinical laboratory scientists, or medical laboratory scientists.
Lab scientists can be found in a multitude of different medical disciplines, from virology and microbiology to the blood bank and hematology. However, this range of disciplines doesn't stop simply at the doors of the hospital or clinic lab, as CLS professionals can be found in fields ranging from biotechnology research to the Peace Corps. Clinical laboratory scientists are responsible for the collection and processing of specimens. They are also responsible for the performance of laboratory tests with both efficiency and precision, as well as being able to explain the significance of these tests and the results that they may show. Lab scientists are also involved in the research of new testing methodology and laboratory instrument design. Healthy Agers procedure. Once the patients are brought down to the bottom floor of Eugene W. Smith Hall, one of the CLS Healthy Agers personnel will proceed to draw the patient blood and then label the specimens accordingly. After collection of the patient's name, date of birth, and time of collection, the patients are then free to go. After that, the CLS personnel will proceed with our testing for HA1C and perform a lipid panel as well.
To begin testing, we will test the hemoglobin A1C. We will do so on the DCA Vantage pictured here. Hemoglobin is a protein found on the red blood cell that is responsible for transporting oxygen. The A1C test is a common blood test that is used to diagnose and monitor management of type 1 and type 2 diabetes. The A1C test goes by many other names, including glycated hemoglobin, glycosylated hemoglobin, hemoglobin A1C, and HbA1c. The A1C test measures what percentage of the hemoglobin is coated with glucose. Since a red blood cell's average lifespan is 120 days, it gives the average blood glucose levels for the past 2 to 3 months. If there is a large amount of glucose attached to the hemoglobin cells, the A1C will be high. This test gives the doctor an idea of how your blood sugar is controlled over time. For someone who doesn't have diabetes, a normal A1C level is below 5.7%. If your A1C level is between 5.7 and 6.4%, you have prediabetes, also called impaired fasting glucose, which means you have a high risk of developing diabetes in the future. An A1C level of 6.5% or higher on 2 separate occasions shows that you have diabetes. An A1C level above 8% means that your diabetes is not well controlled and you have a higher risk of developing complications. For most adults who have diabetes, an A1C level of 7% or less is a common treatment target. Diabetics should have an A1C test done at least twice a year. If someone's diabetes is out of control, the A1C test should be done every 3 months until treatment is in control. To test the hemoglobin A1C, we will prick the patient's fingers with a lancet. The hemoglobin A1C test only requires 5 microliters of blood, so 1 drop will be more than enough. We will draw blood into the collection tube by capillary action. Once the 5 microliters are collected, we will insert the tube into the cartridge. Next, we will scan the cartridge to identify the patient sample in the system. We will then insert the cartridge and pull out the aluminum strip. This test is now ready to run and should be ready in just 6 minutes.
Lipids, the good, the bad, and the ugly. What are lipids? Lipids are fatty substances found in your blood and body tissues. Some lipids can be good for you and some can be bad. There are 4 major types of lipids measured or calculated in a lipid panel: triglycerides, low-density lipoproteins, high-density lipoproteins, and total cholesterol. What are high-density lipoproteins? High-density lipoproteins, or HDLs, are commonly known as good cholesterol. A high HDL level is beneficial because HDLs carry bad cholesterol out of the arteries. Having a low HDL level can be caused by diabetes, smoking, and poor diet and lifestyle choices. What are low-density lipoproteins? Low-density lipoproteins, or LDLs, are commonly referred to as bad cholesterol. High LDL levels can be caused by poor diet and lack of exercise. Having a low LDL is ideal because it means there is less cholesterol left behind in your arteries to build up and create blockages. What are triglycerides? Triglycerides are the most common lipid in the body. High triglycerides correlate with high LDL, or bad cholesterol, levels. Like LDL, triglycerides tend to be inversely proportional to HDL levels. High levels of triglycerides will usually appear with decreased HDL levels. What is total cholesterol? Your total cholesterol level is calculated by using your triglycerides, HDL, and LDL levels together. This value, used in conjunction with some of the other lipid values, can be used to evaluate risk of disease. High total cholesterol can increase risk for coronary heart disease, stroke, and diabetes.
How do I know if my results are good or bad? The reference ranges for each of the tests we will be running can be seen here. Total cholesterol should be less than 200 milligrams per deciliter. HDL cholesterol should be greater than or equal to 40 milligrams per deciliter. LDL cholesterol should be less than 100 milligrams per deciliter, and triglycerides should be less than 150 milligrams per deciliter. A result that goes outside of these ranges would be considered hazardous to the patient's health. If any of these levels fall outside of their range, a doctor or nurse should be consulted to come up with a plan to get things back to normal. Most of the time, this will include lifestyle changes such as increasing exercise and changing to a healthier diet that is low in unsaturated fats to bring down cholesterol levels. Cholesterol levels that remain high may require medication to control. To test the patient, we will take a sample of whole blood and spin it down in the centrifuge. We will then use a pipette to transfer the serum to the disposable centrifuge cup and place it into the spot chem. A fresh reagent strip and sterile pipette tip are also put into the machine and changed after every test. The patient's birthday will be input as the identification number. Once this is done, all that is left to start is the machine. The test will take 9 minutes to run, and then the results will print out.